This case is an example of scarlet fever immediate management. I will show you why scarlet fever needs immediate management. A 6-year-old child is brought to the emergency department with a 2-day history of fever, sore throat, and vomiting. On examination, the child has pharyngeal erythema with exudates. On examination, the child has pharyngeal erythema with exudate. Pharyngeal erythema can be seen in viral pharyngitis and streptococcal pharyngitis. Okay? However, if pharyngeal exudate is seen, this is a streptococcal pharyngitis. Streptococcal pharyngitis presentation is fever, sore throat, and on examination, pharyngeal erythema and exudate. So on examination, the child has pharyngeal erythema with exudates. A strawberry tongue is noted. A strawberry tongue. This is the strawberry tongue. Of scarlet fever. Strawberry tongue of scarlet fever. And a diffuse erythematous rash with a sandpaper texture. Okay, you need to know what is the sandpaper. This is the sandpaper texture, like this, sandpaper texture. Okay, this is the rash with the sandpaper texture over the child's trunk. Diffuse erythematous rash with a sandpaper texture over the trunk. The child is hemodynamically stable and able to tolerate oral fluids. What is the most appropriate immediate management? Oral amoxicillin. Oral amoxicillin. The correct answer is oral amoxicillin. Scarlet fever is caused by group A streptococcus. Group A streptococcus. Prompt oral penicillin antibiotics are indicated to reduce symptoms duration and to prevent acute rheumatic fever. So, why scarlet fever is very important to diagnose? Because scarlet fever is caused by group A streptococcus. So, if not treated immediately with oral penicillin class antibiotics as oral amoxicillin, acute rheumatic fever may develop. Acute rheumatic fever may develop. So, to prevent the development of acute rheumatic fever, group A streptococcus infection in the form of scarlet fever should be treated with oral penicillin class antibiotic, oral amoxicillin. So, oral amoxicillin is an effective first-line option in children who can take oral medications and not systemically unwell. So the patient here, the child is hemodynamically stable and able to tolerate oral fluid, so he can take the oral medication, oral amoxicillin. Okay. Why the other options are incorrect? Supportive care only is inadequate, as antibiotic therapy is necessary. Intravenous ceftriaxone is unnecessary in a stable child. So if the child is unstable and can't tolerate oral fluid, so intravenous ceftriaxone should be considered instead of oral amoxicillin. Delayed treatment increases the risk of post-streptococcus complication. That's why I said immediate treatment. Prompt oral penicillin class antibiotic. Immediate treatment. Why? To prevent the post-streptococcal complications, including acute rheumatic fever. IV benzyl penicillin reserved for severe inability to tolerate oral therapy. So IV penicillin, IV benzyl penicillin, and IV ceftriaxone, IV penicillin. So in this patient, if the child is hemodynamically stable and able to tolerate oral fluid, oral amoxicillin should be given. If the child is unstable, hemodynamically unstable, and is not able to tolerate oral fluid, so intravenous benzyl penicillin should be given. Intravenous administration of benzyl penicillin is the most appropriate next step in this case for severe illness or inability to tolerate oral fluid. So here let's talk about this one. Let's talk about the post-streptococcal complications. Okay. There's no history here. Okay. This is a chest X-ray, frontal view and lateral view. Okay. There is a left atrial enlargement. Left atrial enlargement. As you know, post-streptococcal complication of scarlet fever is acute rheumatic fever. The most common valvular disease in acute rheumatic fever is mitral stenosis. Mitral stenosis. This case is mitral stenosis. How to detect mitral stenosis from the chest X-ray? Left atrial enlargement is the sign of mitral stenosis from the chest X-ray. There is double contour of the right heart border. Okay, let's see that here. Can you see the double contour of the right heart border? Double contour of the right heart border is a sign of left atrial enlargement. Okay, this is a sign of left atrial enlargement. Next finding, splaying of the carina. Splaying of the carina. Okay, this is the carina. Okay, this is the trachea and the right main bronchus and the left main bronchus. There is splaying. This splaying of the carina is a sign, another sign of mitral stenosis or another sign of left atrial enlargement. Double right heart border, splaying of the carina. upward displacement of the left main stem bronchus. There is upward displacement of the left main stem bronchus. Okay, this is the left main stem bronchus showing upward displacement. It should go like this. Okay, so there is upward displacement of the left main stem bronchus, another sign. Okay, left atrial bulge. Can you see this bulge? This is called enlarged left atrial appendage. Okay, enlarged left atrial appendage, which is a sign of left atrial enlargement. Enlarged left atrial appendage. Okay. On lateral view, there is posterior bulge of the left atrium. Posterior bulge of the left atrium. This is the posterior bulge of the left atrium on lateral view. The management here of the left atrial enlargement as a sign of mitral stenosis: medical therapy, antibiotics, diuretics, dietary, sodium restriction, beta blocker, calcium channel blocker, anticoagulant. The role of the antibiotics is to reduce recurrence of rheumatic fever, okay, and to prevent the infective endocarditis. So that's why in this patient, prompt oral penicillin antibiotics is very important. This is another case of mitral stenosis on CT scan to imagine the mitral stenosis. Okay, so here, this is the mitral valve. As you know, the mitral valve is the valve between the left atrium, which is enlarged here, the left atrium, and the left ventricle. This is the left ventricle. So the valve between the left atrium and the left ventricle is the mitral valve, and this one is the tricuspid valve. So this one is the mitral valve. Okay. This image is during the systole. As you can see here, the left ventricle is contracted. Okay. So the left ventricle is contracted here, okay, to push the blood into the aorta, into the abdominal aorta. Okay, so no need for the mitral valve to open here, to open during the systole, as the aim of the systole is to push the blood into the aortic circulation. This image is during the diastole. As you can see here, the left ventricle is relaxed, okay? The left ventricle is relaxed here to take the blood, in order to receive the blood from the left atrium, okay? In order to receive the blood from the left atrium, in order to receive the oxygenated blood which is received by the left atrium from the four pulmonary veins, which came from the lung. Okay, so in order to receive the blood, the oxygenated blood from the left atrium, the mitral valve should be opened okay, during the diastole. Here, the mitral valve is thickened, okay, with incomplete opening. There is failure of complete opening of the mitral valve, okay? Can you see here this valve? Completely opened. However, here, failure of complete opening of the mitral valve during the diastole, okay, with left atrial enlargement indicating mitral valve stenosis. This is the ECG gated cardiac CT scan. Cardiac CT scan.